If you want to develop and progress in your career, you want to remain clinical, then the apprenticeship pathway and the advanced clinical practice is an amazing route to go. The programme has really developed my skills. I had 20 years experience as a staff nurse before starting the apprenticeship, and I loved the fact that I could remain clinical but also develop my career, and so the advanced clinical practice pathway just suited sort of my career progression more. My manager at the time put me forward for a single module in nurse prescribing, which I completed, and then that gave me the confidence to apply for one of the apprenticeship ACP pathway.
So the Advanced Clinical Practitioner Apprenticeship at the University of East Anglia is a really flexible programme. So it's 180 credits at level 7, like all master's programmes. We offer optional modules from minor illness, minor injuries, independent prescribing, end-of-life care, care of the elderly, paediatric examination, all through that spectrum. So an apprentice can really tailor their MSc and their apprenticeship to meet their job role.
I chose a diagnostics module because I work within the emergency department, and it's something that I felt was really critical.
The apprenticeship here is mostly online with some face-to-face days. We know that these apprentices are spread across the region. They have really busy working lives, and being able to dip in and dip out of our asynchronous online learning is really valuable for them to learn at a time that suits them.
You're getting paid to learn whilst on the job. You get allocated study time whilst you're doing your course. I'm allocated 7.5 hours a week within the apprenticeship pathway, and then I get 30 hours a week, which is my clinical practice.
Whilst our apprentices come from every single healthcare profession going, our programme means that the employer will be putting someone through a programme that meets their needs as well as just the apprentice.
As a trust, we really like the apprenticeship route for advanced practice. It allows for a structured training programme where we know the knowledge, skills and behaviours are being taught, and the trainee or the apprentice can work to the required level in academia. The benefits of an apprenticeship is it's a very clinically orientated course. They achieve their academic qualifications through clinical training, clinical exposure and work-based assessments by senior advanced clinical practitioners or our medical colleagues. They're able to deliver direct patient care whilst in training and able to improve their knowledge, skills and behaviours moving forward within the organisation.
So the apprenticeship really brings together the employer, the apprentice and the university in a really nice sort of tripartite agreement where we support one another. I would say that the support that an apprentice gets throughout the programme from the university, the same amount of support that a student gets, but they also get that follow-on through the progress reviews.
I have regular tripartite meetings with the University of East Anglia and my clinical mentors within my work environment. That's just enabled for them to pick up if they've got any problems and offer support if needed.
Apprentices are also allocated an apprenticeship advisor. So they can go to that person for pastoral support, wellbeing support, and basically keeping them on progress and on track.
I've been able to improve the knowledge that I had and enhance that so that I'm now able to assess patients independently, able to diagnose and plan their care.
The role of advanced practice and the role of advanced clinical practitioners is, constantly evolving, and I think the University of East Anglia is really keen, and we're really at the forefront of developing that.
It defines a pathway, a training route to advanced practice that allows the practitioner to come out at the end of it as a well-rounded, knowledgeable practitioner to build on the experience that they brought into the role in the first place.
I've learned a lot. I've watched myself develop both academically and professionally throughout the last 3 years, so I would definitely recommend it.